Have you ever heard about the male G-spot, sometimes called the P-spot? I'm Dr. Rena, a urologist and pelvic surgeon, and today we're going to discuss prostate massage, also known as stimulating the male G-spot. Over the years that I've been active on social media, I've received many questions about prostate massage. People often ask if it's safe, whether it actually provides any benefits, and if it can help with conditions like BPH or improve sexual function. Today, I'm going to explain what's fact and what's myth. Let's begin with the basics. What exactly is the prostate? The prostate is a small gland, about the size of a walnut, located just below the bladder and surrounding the urethra. Its primary job is to produce prostatic fluid, which mixes with semen during ejaculation. This fluid helps nourish and protect sperm, so they can survive inside the female reproductive tract. The prostate also contracts during orgasm, which helps push semen out of the body. Because the prostate is surrounded by many nerves, stimulating this area can sometimes create a strong sensation of pleasure. Prostate massage is a manual technique where pressure is applied to the prostate gland. This can be done either to release fluid from the prostate, which urologists have historically done to help diagnose or treat certain conditions like prostatitis, or simply for sexual pleasure. The most direct way to massage the prostate is internally, which means reaching it through the anus and into the rectum with a finger. The person performing the massage should wear a clean glove, wash their hands thoroughly, and keep their nails trimmed to avoid injury. Using plenty of lubricant is also important, ideally a lubricant specifically made for anal use, because the pH of the rectum is different from that of the vagina. It's best to use a lubricant that is iso-osmolar, or close to the natural pH level of the anus. Once the finger is well lubricated, it can be gently inserted into the anus, about 1 to 2 inches, and then angled upward toward the belly button. In that position, you may be able to feel the prostate. It sits just in front of the rectal wall and usually feels like a smooth, rounded bump, similar in texture to the tip of your nose. From there, gentle pressure can be applied to massage and stimulate the gland. The most important rule is to be very gentle. Too much pressure or rough movement can cause discomfort, pain, or even injury and bleeding, since the tissue in that area is quite delicate. There are also specially designed devices and toys created to help massage the prostate. Many of them are shaped with a curve so they can reach the right spot more easily. If you choose to use one, always keep it clean and make sure it is specifically designed for anal use. You definitely don't want anything getting stuck inside the anus, and believe me, that happens more often than you might think. Some people online say that the prostate can be massaged through the perineum, which is the area between the scrotum and the anus, often nicknamed the taint. However, as a reconstructive urologist, I operate in that region regularly to treat conditions such as urethral strictures, which are narrowings of the urethra. When these strictures are located very close to the prostate, meaning they're quite proximal, it can actually be very challenging to reach the prostate. Even with surgical tools, access is difficult because the prostate sits behind the pubic bone. In certain cases, to truly reach that area, I may even need to remove a small portion of the pubic bone to access the prostate properly. So, stimulating it directly through the perineum is quite difficult. That said, massage around the perineal area can still feel very pleasurable. The reason is that the corpora cavernosa, the two cylindrical structures responsible for erections, extend deep into the pelvis and curve downward toward the perineum. When that area is massaged, you're also indirectly stimulating erectile tissue, which may increase sexual pleasure. In addition, it's possible to feel or gently press on some of the pelvic floor muscles through the perineum, and that stimulation might help those muscles relax. Historically, prostate massage has been used in urology as a possible treatment for prostatitis, which is inflammation of the prostate. However, the scientific evidence supporting this treatment is fairly limited. Now let's talk about whether prostate massage can help with BPH, or an enlarged prostate. BPH is extremely common as men get older. In fact, about 80% of men in their 80s will experience BPH. This condition can cause several urinary symptoms, such as frequent urination, a strong and sudden urge to urinate, waking up multiple times at night to go to the bathroom, a weak urine stream, difficulty starting urination, or a stream that stops and starts. You might hear people online claim that prostate massage helps clear out the prostate. But currently, there is no strong scientific evidence showing that regular prostate massage can reduce symptoms or shrink an enlarged prostate. It may feel good for some people, and that's perfectly fine. However, it's important to remember that the tissue in this area is very delicate. If the massage is too aggressive, done too frequently, or performed unsafely, it can cause bleeding. In rare situations, if there's already an infection, inflammation, or even prostate cancer present, it could potentially make the symptoms worse. Now let's talk about sexual function, because as I mentioned earlier, prostate stimulation can be a source of pleasure for some people, and many are curious about it. So the question is the prostate really a magic button for better orgasms? It's often called the male G-spot, after all. As I explained before, the prostate is surrounded by nerves that play a role in arousal and erections. For certain individuals, stimulating the prostate can feel very pleasurable and may make orgasms feel stronger or more intense. In fact, in large research surveys, some people report that prostate massage makes their orgasms feel more powerful or more enjoyable. That said, it doesn't work the same way for everyone. In those same studies, while some people enjoy prostate stimulation, others experience pleasure simply from stimulation of the anus itself, or even just the feeling of fullness in the rectum. And for people who don't enjoy it at all, that's perfectly okay too. You can absolutely experience satisfying sexual pleasure without ever including prostate massage. If you're curious about trying prostate massage, here are a few helpful tips. First, always make sure there is clear consent. Have an open conversation with your partner, whether you're asking them to stimulate your prostate or offering to stimulate theirs. Use gloves or a clean, well-lubricated finger, or consider using a toy specifically designed for anal use. Unlike the vagina, the rectum does not produce its own lubrication, so using plenty of lubricant is essential. Move slowly and keep your touch gentle. However, there are certain situations where prostate massage should be avoided. If you have acute prostatitis, meaning an active infection of the prostate, stimulating the area can worsen symptoms and could even require hospitalization. Symptoms like severe pelvic pain, fever, or chills may be signs of prostatitis. Also, if you suspect you might have prostate cancer, or if you've already been diagnosed with it, prostate massage is generally discouraged. In theory, it could worsen the condition. Even though I haven't personally seen this happen in clinical practice, it's still something doctors advise caution about. So the bottom line is this. There's no strong scientific evidence that prostate massage improves BPH or urinary symptoms. It may add to sexual pleasure for some people, but it isn't guaranteed to improve erections, libido, or other aspects of sexual function. Everyone's body responds differently. It's not a magic step that must be part of your sex life, but for some people, it can certainly be enjoyable. If you found this video helpful, consider sharing the channel with a friend or family member who might benefit from it, and don't forget to subscribe. It's a completely free way to support the channel and continue receiving reliable, evidence-based information about sexual health and more. And as always, remember to take care of yourself, because you deserve it.